Hello, everyone. This is Chris Frederick on behalf of the Collaborative Care Collective. I'm so excited to be here with one of our premier presenters, Dr. Dawn-Marie Ickes. Welcome.
Good morning. I'm
Good
thrilled to
morning.
be here. Thank you so much. I'm so excited to talk to you about this conference coming into its third year and
Mhm.
the things that we have in store that have just been inspiring me since the end of last year when the ideas around it were coming together.
Well, the listeners, let us have them get to know you a little bit with a little short bio. Your bio is so extensive, but I'd like to keep it as a nutshell. And for those of you listening at the website, collaborativecarecollective.com, you can see Dr. Ike's a very extensive, very rich background. But let's hear a little nutshell from you.
Thank you. I'll be blushing a little bit. Thank you for that.
Okay.
I have a holistic practice that really integrates this idea of supporting long-term movement health with a comprehensive, whole person, whole body centered approach. So I integrate in my private practice manual therapy with movement reeducation and breath. Like that's the easiest way to explain what I do. I approach the body as an interconnected system that is really adapting to its environment, the demands that we place on it, and the other things that hit us in life. And as part of that, I am also, in addition to being a clinician, I am a researcher and an educator in a doctoral physical therapy program in Los Angeles. And that has really been fulfilling my life's purpose, I would say, for the last 15 years since I transitioned out of more full-time private practice and into a split practice that does education, research, and then I do still see patients.
Excellent. That is an extensive background. You have much more to say, but I think we'll go on to one of my questions I have is about your presentation. So, as I think one of the first speakers at the conference, your presentation is titled "One Step at a Time: Gait as a Shared Movement Vital Sign Across Disciplines." If you could share with us your excitement and passion about that, we would all love to hear that.
So it's a topic that lies at the heart of my clinical practice. I use gait each and every day with every single one of my clients. The first thing I do is watch how they're walking. So the idea of being able to share those insights, the experiences, how gait is really a dynamic reflection of whole body integration, which I think really reflects our whole body health. So more than just a tool that we use as physical therapists to assess, looking at it as a vital sign, I think that is really where we can see how thoracic mobility, integrated core awareness and control, movement, and then how we load and distribute the forces, whatever they may be, based on what we're doing. Gait is really kind of a one-stop place to be able to see those things. And so when Gail was talking to me about some ideas for this, I really was excited to share how this kind of holistic, integrated understanding of gait, not just as a movement educator, but really from this larger macro view as physicians, physical therapists, personal trainers, dance teachers, movement instructors, et cetera, could really give us insight into how bodies are functioning from all these different perspectives. Because, when we have a collaborative team approach to how we're helping clients transition from some of the physical challenges they have, then there's a bunch of different insights that come into it. So that's why I was initially really, really excited from it. I'll keep talking, I know, forever, but get really
Well,
excited. Topic.
collaboration is the theme, so I'm glad you did mention that. And speak about collaboration, we do, like we've had at the past summits, we've had physicians, physical therapists, occupational therapists, all kinds of therapists, allied health professionals, as well as movement professionals of all kinds. So very
Right.
exciting to have everyone from these diverse populations coming. Could you speak to physicians? What does your presentation offer a physician listening to? What takeaways would they get?
So, one of the things I wanted to bring to the plate as a concept or as an idea is considering really how this larger understanding of gait can really transform our assessment and guide our interventions. And so, whether our assessment is what the physicians do, what I've seen some of the great doctors that have presented in years past at this conference do as part of their assessments, or it's what these pioneering physical therapists do as their assessments, or even movement educators, if we can really look at how it can transform that and inform how we make certain choices, what I'm looking to do is use the evidence and some of the clinical findings that we have in the last 5 years to try to kind of shape this lens from this. I don't want to get too much into biotensegrity and myofascial integration because there are other experts that are going to be speaking to that. But my macro view does integrate those as a crucial foundation and part of how we can use gait to look at the influences those have on our bodies. And then now we have it as what I like to call the movement vital sign, which just like we take blood pressure to see how our heart is functioning, we're going to be looking gait to see kind of this macro view of how our body is functioning, but also our whole body internal systems, because we can have issues with myofascial relationships, restrictions, fascial restrictions that can affect how we walk, how we move, not just with our functional assessments, but actually how we move in day-to-day life. And if you think about how many steps the average person takes a day, it's like over 5,000, we hope. More people we're hoping are taking more like 10. That's a lot of opportunities for failed load transfer or inappropriate energy disbursement or not proper utilization of our own internal biomechanics to really create some of the problems that we might see. So I'm hoping to foster this deeper appreciation to kind of bring this lens through a window of a more holistic health approach to early detection of certain movement dysfunctions and maybe other dysfunctions that people are suffering from. And then the other part of it, the more measurable part, is really looking at it as a screening tool, an outcome measure, something that we can circle back to so that it guides the sequencing of the interventions, whatever they may be, whether we're going to be doing an injection or we're going to be doing a manual technique, or we might be releasing visceral structures or myofascial structures. How does that guide the sequencing of the intervention? And if we have that place to look at a pre-intervention and a post-intervention sequence of movement, we can start to determine okay, this really worked for that part of the thorax, but now we want to look at something else to work into that area of the pelvis that's maybe not doing what we want it to do.
I love the whole macro view of gait as a vital sign. I've never heard it put that way, and it makes a lot of sense because you can pick up on so much by looking at the forest before you look at the trees, essentially.
Right.
So is there anything else that you want to say to physical therapists in particular, since that's you and me, and we do more than just physical therapy? I don't want to say just, but we do more than physical therapy as well. How about those, our colleagues coming in from that, those industries?
Well, I would like to challenge PTs. I mean, we learn early on in physical therapy school how to analyze gait, and we get really caught up in looking at what's wrong with gait as opposed to what is right and what is in balance. And so, what I really hope to share or to I don't even know if guide is the right word, to in part is this idea that if we can look at where movement is maybe not in balance, as opposed to identifying what's wrong, let's take this wellness view. What is working properly? What is moving, quote unquote, more correctly or in better balance? And what could use a little bit of enhancement? That speaks a little bit more to fascial load, fascial elasticity, proprioception, body awareness. Can we make subtle shifts in breath and awareness that actually improve certain things? So it's not just coming in with these passive interventions, but it is coming in with interventions that bring kind of a broader awareness of how the body is functioning as a whole. And then, because the therapists are coming in with their own background, their own experience, expertise, knowledge, and wanting to find sometimes new and innovative techniques. We go to the APTA conferences to learn those. But sometimes it's not about the new, it's about
Mhm.
what we know, but looking at it through that different lens. And so I hope to present some different options and ideas for whatever that different lens might be for the people attending, because everyone's not coming from the same place. We're going to have varying degrees of experts and movers. And I just want to pose that question of when I'm looking at this, what could I be looking at differently? What could I be considering that maybe I hadn't considered before? Not that I don't know it or understand it, but I've never considered that. So that's really where my approach comes into that creative piece because, performance, injury prevention, all of those things, there's a lot of good standard evidence to support that. But we don't know how that is going to translate to the individual human body in front of us because that body has its own story that it has lived and it is going to continue to live. So when we want to really make those integral changes, I think honoring and respecting the uniqueness of the body in front of us and then how what we know about gait and what we know about what that body is doing more in balance and what we know from techniques, or maybe we don't know, but we're going to try certain things. We're going to look at things differently to try to see if we can optimize better balance for that movement. Because if it starts with a little bit better balance, it can, in my belief system, it can really transform that person's whole body and whole life experience through movement, however small or large that improvement may be.
Love the application. When I'm hearing and what I see in my mind's eye is the application of art, the art of science, the art of science application on top of the evidence. The evidence cannot answer everything, and certainly not from a holistic viewpoint. That's the missing link, is connecting the evidence to the holistic qualitative little coaching tips about the breath could yield enormous benefits and ahas from the clients and patients, right? So I'm getting tinglies right now. I'm getting
Oh,
goosies.
I'm,
Uh,
I'm just really excited. I could talk about it all day, every day. I know
that
we have a
we
small,
need,
but
yeah, we need to collaborate. All of us need to collaborate, and the mixture of art and science is where we're at because we reach some of the limits of evidence is still coming out every week, if not daily. And it's hard enough to stay on top of that, but you need both, right? You need both, especially when you take the whole person into account from calcaneus to cranium, you know,
love
right?
it.
We have to put it
Movement is
together.
medicine. I mean, we know movement is medicine. People can't move, things break down. Little
And
movement
speaking and
can
speaking of that, the movement professional, I think you pretty much spoke to everyone. Is there anything else you want to add for the movement professional? I mean, just please state what you do in the world of movement. Pilates, hello.
I think, yeah, well, there's that. I think for the movement professional, it's really empowering the movement professional to take the skills they've already learned. If they have a background in yoga or dance or Pilates, at some point, if they're a teacher, they've had to analyze movement. They've had to analyze posture. They've had to see how bodies move. And I think that for the movement professional, it's really that idea of looking beyond the static postures, but really, how does this amazing system that we have, this amazingly technical, anatomical, biomechanical system of tensegrity and myofascial integration, how does that respond during gait? And how can we use gait, because we know a little bit about gait and it has these certain parameters, as movement educators and movement professionals to really influence even the choices of the exercises that we might be utilizing to develop a program with that client. And even if it's not a Pilates instructor or a yoga instructor, but a personal trainer, are you looking at gait? Are you looking at how gait is impacted by these restrictions someone may have? And then are there certain strength training or certain types of exercises, good mornings, RDLs, unilateral suitcase lifting, that can really help affect how people have mobility within their body, and then look at how it changes their gait. I love it when I see personal trainers at the gym that are like, well, let me see you walk. Okay, now let's do this. Now let me see you walk again. Like really looking at the influence of certain strength training exercises on how that increases the fluidity and the mobility of the hips and movement. So I love it when I see personal trainers using gait kind of as a pre and post assessment to see
Right.
how the exercises they're giving to improve someone's hip mobility or strengthen their glutes then translates to opening up their hips and then their gait is improved. So I think there's something for everyone with the way we've structured it. Again, I'm really trying to make it an opportunity for everyone to see gait through the lens that works best for them and maybe consider elements of gait that maybe they had not previously considered in their practice as this movement vital sign with how the body in a dynamic environment is really moving through life. Because we have functional movement assessments. We know those are extremely useful. I learned so much through Diane Lee's mentorship, and I still use those with each and every client as well. And I do think that having that next step, which is how do we pull back from that and just look at how someone's walking, and can we identify little subtle nuances of how they're loading or maybe not loading in a way that's going to optimize their function, and does that translate to some of the descriptions of what they're feeling in their body? I try not to use terms like symptoms. I try not to use terms like pain as much as what feels like it's out of balance and isn't working optimally for you, so that we're also changing the linguistics around how we address things not being as optimal as we would like them to be. So,
Well, Dr. Dawn-Marie Ickes, thank you so much for your
well,
time,
thank
your
you.
expertise, your rich background. I can't wait for your presentation for me
Aw,
to listen to it. And I invite again physicians, physical therapists, all therapists, allied health professionals, and movement professionals. Come one, come all to the
thank
Collaborative Care Collective.com. We'll give you all the information. June 2026, we have the dates, all the information. And again, thank you for your time.
Oh, thank you. I'm looking forward to it. I can't wait.